Welcome to my YouTube channel, Chronic Pain Solutions. I am Dr. Jamie Hampton. I am director and founder of San Francisco Dry Needling Clinic. I'm here today to talk to you about something that I am extremely passionate about, which is getting people out of pain successfully and getting them back to their activities of daily living. I know that you all have heard me talk about this before, but I want to kind of demystify what it is that I do in terms that everyone can really wrap their brains around and understand and see if it's going to be the right thing for you. So the thing that I do best, that I love the most, is a specific technique called myofascial trigger point dry needling, which was a term that's been recently shortened and abbreviated to dry needling because it's easier to remember. Myo means muscle. Myofascia, fascia is the soft tissue that actually compartmentalizes muscle spindle fibers and also encapsulates the muscle itself. But fascia is found all throughout the body, and it's something that we're not really quite understanding its full potential right now in the medical field because it's kind of been poo-pooed before. Especially, I remember back in my days when I was doing cadaver dissection labs, you would slice perpendicularly into the cadaver and you would discard anything that wasn't muscle, tendon, ligament, organ, vessel, that type of thing, nerve. But the fascia is the beautiful silver skin over the muscle, or the deep silver skin, but it also is around organs, it's around bone, it's everywhere in your body, and it is the most proprioceptive tissue in the human body. And what is proprioception? Proprioception is this amazing mechanism that allows us to feel temperature, to feel pressure, to feel pain, to feel tickles. It sends signals to the brain, and it's this absolutely lightning fast fiber optic network of stimulation that goes straight to the brain. So you know if you've stepped on a nail, you know if you've stepped on a feather, you know if someone's behind you and to the left if your eyes are closed. So it's a wonderful kind of this sixth sense that we have as a human species, and animals as well, mammals, I should say. So what is myofascial trigger point needling? I'm going to make this so simple to understand that you are going to say, I get it and I need that. Everyone needs this. Everyone needs this. When you have stress and you think, oh, my shoulders are really tight, I have knots and rucks in my shoulders, those are actually contracted muscle spindle fibers that are found in your possibly upper trapezius muscles. That is causing less blood flow to the area. So when you touch it, if you squeeze it, if it gets hit, you think, oh my gosh, that hurts so much. Well, it hurts because it needs attention. If you take a needle and you put it into that spot, obviously you go to a very highly trained dry needler or an acupuncturist to help you unlock these myofascial trigger points. The muscle is instantly fatigued and it can no longer contract. There's something called a fasciculation that occurs in the muscle, which is a big jump. It's a big release. It's a spasm. And when that happens, that gives me feedback that, oh, you really needed that because that was a pretty profound release. Oftentimes, specifically working in upper trapezius and lower cervical, people will say, oh, wow, I feel a rush of blood to my head. Well, you do feel a rush of blood to your head because that's what's happening. If the muscle's very tight and it's contracted, it's balled up, it can be pressing on vessels like capillaries, arteries, nerves. It can be compressing and strangling all of those things that are like highways that need to flow through the body. When that happens, when the muscle is if this is your nerve or your artery, if the muscle is pressing it, you see my finger is turning pink, right? While I'm cutting off the circulation. If it lets go, the blood is able to continue. It's able to fully get where it needs to be, so it can saturate the tissue, so it can feed the tissue, it can nourish the tissue, it can carry that, number one, the oxygenated blood to the area that it needs to be. So it's instantaneous relief. People will say, oh, it's gone. My shoulder is so relaxed. It hasn't been this relaxed in 10 years. That is what essentially myofascial trigger point dry needling is. It's unwinding those constant chronic contracted pain patterns in muscles. It can be in tendon, it can be at muscle attachments, it can be in the fascia, it can be anywhere actually. But profound relief is instantaneous. There is, of course, there is some side effects that can occur, which is totally normal. A lot of people say, oh, I feel sore in a good way. Well, that's good. That means the tissue is actually, it's relaxed, it's functioning more normally, it's able to heal itself. We want the body to heal itself. We are merely facilitating your body's healing mechanism. Your body never says, I don't want to heal myself. Nope, I'm done. It never ever says that. It says, wow, I have been so tight for so long and I've been giving you headaches. Or I've been so tight for so long, I'm causing abdominal stress and tension and I have frequent urination. Or, oh, I've been so tight and so tense for so long, I have nerve pain. Myofascial trigger point dry needling is good for so many things. And as Dr. Janet Travell and Dr. Simons had pointed out, most of their patients who came in to see them were misdiagnosed, underdiagnosed, or just dismissed as saying, oh, all the tests came back normal, you're totally fine. Let me back up. For people who don't know who Doctors Travell and Simons are, they are the absolute grandparents of myofascial pain syndromes. They are the doctors who said, no, actually there is something wrong. We just don't know what it is, but let's poke around and find out and see what we can do to help. So, during the early days, and we're talking, the 1950s and thereabouts, they were finding these tender points in their patients and they were seeing patterns. Oh, we're seeing that, for example, headaches there's specific patterns for tension headaches. How can we help those patterns for tension headaches? And they were actually treating their patients with hypodermic needles, which not to be confused with the needles that we as acupuncturists and as certified trained dry needlers are using. We use solid filiform needles, which can actually fit inside the hypodermic needle. Many can fit inside a hypodermic needle. So hypodermic needles are meant to withdraw fluid from the body and inject fluid into the body. These are the needles that we use are completely solid and they're very, very flexible and extremely thin. And it's pinpoint accuracy into those trigger points and bands. So it is a little different. We're evolving as a medical field for dry needling. And at any rate, it's much more comfortable than having a hypodermic needle poked into your body. But they were seeing these pain patterns in patients and realized, oh, well, we treated Susie for tension headache and we did a trigger point release in her upper trapezius fiber and she was able to completely resolve her tension headaches. So that's pretty profound. And to have a side effect of just soreness with no internal medication needed, unless, you've discussed it with your doctor about being on specific meds for your condition, just minimal recovery time. It might be, tender for a few days at the most. Personally, my patients usually feel better after about 12 hours, but they feel looser, they feel taller, they feel more alive, they feel like their muscles are actually activated and they're able to actually perform their activities of daily living almost right out of the gate when you do dry needling. But I love what I do, and it drives me to do more and to treat more. I treat everything from temporomandibular joint disorder to post-concussion syndrome, headaches, migraines, pelvic floor disorder, you name it, I've seen it. And it just keeps me so engaged, and it's so integral for you to understand that you are a part of our team. We are on your team. We're on your side, and our goal is to get you back to life, back to the joys that you are living, your activities of daily living, and out of pain. So if you have any questions for me, please feel free to shoot them down in the comments. You can also reach out at sfdryneedlingclinic.com. You can shoot me an email. I'm Dr. Jamie at sfdryneedlingclinic.com. I'm happy to talk with you about how we can help, what's best for you. And I just want to thank you so much for clicking and liking and subscribing to my channel. So please stay tuned. I will be giving lots of new videos, and I look forward to seeing you soon. All right, have a great day.